Hello, this talks about UVC and I've titled it Ultraviolet Blood Irradiation, Science and the Machine. And so I've divided into two bits. First of all, talk about the science and tell you about the peer-reviewed scientific literature which is already available about ultraviolet blood irradiation. And that I've divided into four bits: plasma and cell studies, animal studies, clinical trials, and reviews of the literature. So that's part one. Part two is to show you my machine, which is an ultraviolet blood irradiation machine using UVC, and which has an EC certificate and which needs certain accessories to go with it to make the whole procedure, so I show you those too. So those are the two parts of my talk, and I'd like to start out by looking at some of, and there are very many, plasma and cell studies testing the effects of UVC, ultraviolet radiation in the C band, which is between 100 nanometers and 280 approximately nanometers. The other two bands, UVA and UVB, have longer wavelengths than that, and they go up to 400 nanometers, which is the edge of our visible light spectrum. So they're non-ionizing, they're not powerful enough to chip away the electrons from atoms with which they're associated, so they're not likely to do as much damage, for example, as ionizing radiation, which is the stuff of which atom bombs are made. First of all, I'd like to talk about plasma and blood cells studies, and because it's much easier to take blood from a patient and try out UVC on it. It doesn't risk any harm to the patient, and it can tell you a lot about how effective or otherwise UVC is in inactivating a virus contaminating those items. So I'd like to start with the earliest one, which was in 2006, and it appeared in the journal Transfusion, volume 46. And it was conducted by Miriam Darnell and Deborah Taylor, who work for the Center for Biologics Evaluation and Research at the US FDA, Food and Drug Administration in Bethesda, Maryland. And what they were doing was testing out 4 different means of inactivating viruses, particularly the SARS-CoV virus, which had been a risk at that time. In 2006 it was all over, but they did want to carry out these studies. And they found that UVC efficiently inactivated the virus in protein solutions, and by that they meant serum from infected patients as tested by PCR, and it inactivated that virus in 40 minutes. And subsequently UVC blood irradiation was approved by the FDA for emergency use, but has never, to my knowledge, been used to treat SARS-CoV-2. This was SARS-CoV-1 for some reason, and this is what I would like to now begin to propose, first of all, of course, with these studies. So that's the plasma and cell study that started me on this video. The second one came from German Red Cross blood service at Springer, Germany, and it was conducted by Eichmann, Gravermann and their colleagues, and this was inactivating Ebola virus and Middle East Respiratory Syndrome, MERS, coronavirus, and they were using as a model platelet concentrates and plasma, and they were exposing it to UVC. And what they found was that they used the Theraflex UVC exposure system, which is at 254 nanometers, and they inactivated both of those highly infectious viruses in human blood platelets to the limit of detection. The third plasma and cell study I want to mention is another one by Eichmann and Grafman, and also for the German Red Cross, but this is a brand new one, and it appeared in a different journal, Vox Sanguinis, volume 115. Now this study tested again the Theraflex UV system, and they were this time testing severe acute respiratory syndrome virus, SARS, and they were testing the Crimean Congo hemorrhagic fever virus and the Nipah virus, and they were using platelet concentrations, and they tested it by several of the Theraflex systems. And the UVC system reduced viral activity to below the limit of detection in those platelets. So it's another positive study. The next one is from Columbia University, New York, and this was by Buonanno, Welsh et al. But they didn't use 254, they used 222 nanometer UVC. And they were looking at how it could be used in airborne virus inactivation. So they used the 222 nanometer UVC ability, and they tried two coronavirus types carried in water droplets, and the results were indicating 99.9% inactivation in 25 minutes exposure. The next one is from Australia. That's the Australian Red Cross Blood Service. Again, this was in 2019 and appeared in Transfusion Volume 59. And this study again used the Theraflex system, 254 nanometers, and to inactivate yellow fever, arbovirus, in platelet concentrates, and they found the inactivation was by log 4.8. That's a huge amount or greater. Then the next one is actually from Duke University in North Carolina, and it's by Eichscheid, Meyer and colleagues, and from their Department of Civil and Environmental Engineering. And this is an early study, and it was more or less designed for the water community industry to use UVC as a means of sanitizing water. And they have, so most of their refs, and 43 refs in the paper, are referring to water treatment. But they use PCR to evaluate the UVC dose required to damage or inactivate adenovirus. Now they use adenovirus because this virus is particularly resistant to ultraviolet, so it's used as a benchmark. And the comparison of lesions per kilobase, is the way they tested it, suggests that a higher UVC dose is more bioeffective when you're inactivating that kind of virus. An early study, but nevertheless interesting. And that's it really. Those are the plasma and cell studies I wanted to talk about because they are the prelude to further research. It's easy to use plasma and cells, blood cells, and white blood cells or red, in studies because they don't have any adverse effect on patients. But then the next stage after that will be animal studies. At the turn of the century, when Emmett Knott was doing his research into UBI, animal experiments were quite common, and one of the worst and all the best candidates for those were dogs. as you remember maybe from the conditioning experiments of Pavlov. And Emmett Knott himself used dogs to test out the procedure before he came to apply it to human beings. So since then, animal experiments have gone out of favour and become more and more expensive and less politically correct. So I only have a couple of animal experiments in this presentation. The first one really was on mice by a Japanese medical school, the Nagoya University Medical School, and the authors were Morita Nishida and their colleagues. And what they did was to starve mice of vitamin D and then applied ultraviolet radiation with an LED device, and they found that it effectively increased the serum levels of vitamin D. Now, vitamin D is a very important component in coronavirus infection relief, and other studies, which I won't have time for here, have shown very conclusively that the ingestion of vitamin D in the right quantities can reduce the level of infection and subsequent death. But that was the only animal study I felt worth noting. Then the other, well, it's not really an animal study. It was a study on animals in the sense that pigs were used, but what happened was that they took the pigs' lungs out of them and did a randomized controlled trial. And this was a Canadian study, Galasso Field and their colleagues from Toronto General Research Institute and in Ontario, Canada. And that was published in Nature Communications in 2019. Now, what they did with the lungs, the ex vivo lungs, were they exposed it to UV and found that there were no adverse effects on the tissues, but they found that hepatitis C virus in those lungs was completely abrogated by UVC after only 150 minutes exposure. Well, those are the only two animal studies I want to talk about, so I would like to move on now to the clinical trials. And to be honest, they're a bit thin on the ground. I think one can't really avoid mentioning the classic study really by Emmett Knott himself. It wasn't so much a clinical trial as an exposition of the preparatory and research work that he did before trying out UVC for the first time in 1928 in desperation when a female patient was about to die from septicemia. After that, the same year in 1948, George Miley and Jens Christensen published a study in the Review of Gastroenterology, which reported, it was a case control study really, they reported the successful results of 74 cases of various kinds, but all of them relating to acute virus-like infections, and that was published in 1948 in volume 15 of the Review of Gastroenterology. Among the modern clinical trials of UBI, ultraviolet blood irradiation, I've chosen one by Thiele, Pola et al. Again, this is from Vox Sanguinis in 2015. It's a small study, and again it uses the Theraflex UVC system, which is at 254 nanometers. and without any photosensitizers, but they used this system on 11 reinfused healthy volunteers, and neither the adverse reactions related to transfusions nor antibodies against UVC treated platelets were observed. So it was a success, and it was for testing for pathogen reduction. Phase 1 clinical trial, very small. The next one I want to mention is one by Kunster, Mukherjee et al., which was, and they're from Temple University in Philadelphia. They published this in 2019 in Cogent Medicine, volume 6. Again, it's a small trial, 10 patients, and it reports the results of an FDA phase 1 controlled clinical trial following that trial that they did before in 2015. The viral load was assessed before and after the 5 treatments that they gave over 3 weeks, and they showed a 56% reduction post-treatment. No adverse effects of the procedure, and one of the things about this study is that it contains a useful review of all the previous UBI literature. There weren't that many clinical trials in the West, but meanwhile, in the 90s onwards, the Russians carried out a number of trials. Now, unfortunately, their work is only available in English, in abstracts, and so I haven't been able to get the full texts as I have with all the other papers I've presented in this video, but I just present here a table of the names of the authors and the year in which they were operating their systems and the kind of focus that each study had. It's only a very summary thing. You can get the abstract for each review, but you can't easily get the full text except in Russian. Well, the next section of my talk is on the reviews. And I think in a way these are more helpful than the clinical studies or animal studies or the cell studies, because they look at the mechanisms of interaction and they catch hold of a lot more literature than I've been able to include in this short talk. And the first one I think you ought to know about, and probably the most well-known really, is that by Ziming Wu, Zeno King Hu, and Michael Hamblin from the Department of Dermatology at Harvard Medical School, Boston, Massachusetts. And the Chinese authors are from Nanning in China at Guangxi Medical University, which is a big university there. And that was published in the Journal of Photochemistry and Photobiology B in 2016. And it's a pretty comprehensive review of the literature at that time, with 93 references, which will enable anyone reading it to follow up that information in greater detail. And it compares UBI with the other ultraviolet radiation technology of EPC, electrophoto technology, and it concludes that UBI should be more investigated than it is. Well, it has been more investigated, as you will see from the numbers of countries from which the studies I've been mentioning have come. And this one is from Italy, and it's a review of really the way in which medicine has been experimenting and researching how to reduce pathogen in platelets, red blood cells and whole blood from the point of view of transfusing blood into patients from blood donors. And this study is by Paolo Rebulla, and he comes from the IRCCS Grande Ospedale Maggiore Policlinica of Milano, Italy. And that was published in the British Journal of Haematology in 2019, volume 186. Now what he did there was to review the 3 decades history of infection transmission reduction, and he concludes that UVC, ultraviolet C, procedures, and he liked Theraflex, and I've mentioned Macopharma, Tourcoing in France, are highly effective with log reductions up to 7, which is pretty huge reduction in the infection. Well, the new studies and the reviews are increasing, and here's one from Spain by authors Velázquez Rodriguez et al. And that appeared in PLOS One online. This is an online journal in February 2019, volume 14, number 2. But this is an evaluation of the effectiveness of the Sure Pure turbulator. This is an ultraviolet C radiation equipment to inactivate different enveloped and non-enveloped viruses inoculated in commercially collected liquid animal plasma. So they used plasma for this study, and they used swine viruses, 10 different swine viruses, and they found that the UVC was highly effective. And another issue in this study is that it gives 61 references to UVC related studies for further investigation. Well, finally, in March 2020, Stanislav Stavitsky from the St. Luke's University Health Network, Bethlehem, Pennsylvania, asked the question in his review, could tracheobronchial ultraviolet C irradiation be a valuable adjunct in the management of severe COVID-19 pulmonary infections? Now, he reviews the coronavirus sensitivity to UVC, but he proposes a different kind of treatment using a tracheal fibre optic LED lamp insert into the bronchi, which is a pretty invasive treatment, but he does propose that as one solution using UVC, but not irradiating the blood outside of the patient. Instead, it's using a fibre optic tube to go into the actual lungs and irradiate there. So, and finally, Heisling and Hohnes and their colleagues from Germany, this is a German study now, then German review, talk about ultraviolet radiation doses for coronavirus inactivation. They review and analyse the inactivation studies that have appeared, and the studies that they've produced are published in GMS Hygiene Infection Control 2020, volume 15. Now this came out in May 2020, so it's very up to date, and it reviews the dose literature, 32 references, and based on the view that all coronaviruses are similar in structure and similar strand length. And the conclusion of the study, or the review rather, is that an upper limit dose of about 10.6 millijoules per square centimetre will inactivate the new SARS-CoV-2 virus without modification. And to quote from that study, to date, ultraviolet C radiation has been effective against all coronaviruses in all published investigations. Therefore, it can be concluded that existing ultraviolet C disinfection systems and procedures will be sufficient to deal with all coronaviruses, including SARS-CoV-2. Well, that's the conclusion of the Ulm University study I just described, and it's mine too, that we have really been surprised in the scientific community why governments have not been in any way interested in this new form of treatment, but have concentrated solely on vaccines of various kinds. And so I now want to show you in the next part of my talk what a machine looks like and give you some examples from different machines. Well, now I'd like to show you an ultraviolet blood irradiation machine. This one is the Ultralux 750, and you can see it's pretty simple. There are simply only two buttons. The one on the right just turns on the electricity, and the one, or turns it off, and the one on the left turns on the UV lamp. So that's all there is to it. To get it ready, you have to open up the lid, which I'll now do, and inside you will see 4 lamps. 2 of them are UVC, these 2 at the top. Just come up to the top. Yes, there they are. So there are 2 UVC lamps here. And then on the bottom, you can put 2 more lamps, which are actually what these are on the bottom at the moment, just because that's the way the machine's been set up, are 2 UV lamps. One is UVA and one is UVB, but it's quite easy to change those for a UVC lamp like this one, or 2 of them, and you can or take them out altogether. So that's the setup, and it's so simple to operate. Now, how you operate it is by getting a quartz cuvette. Now, these are sealed at the moment, but I'll show you what they look like. You could probably see them through the packaging. There are 5 sealed units here. And if you look very carefully where my finger is, you might just see the quartz cuvette sitting inside the package there. And at this end and that end are tubes, sterilized of course, to allow the blood passage. Now the cuvette itself, this has got a spiral interior, so the blood, as it passes down through the cuvette, will be turned around, and that gives even exposure to the blood as it goes past. And how it sets in here is that on this side, I don't know, yes, on this side you'll see there's a little nick in the metal, and on the same as on the other side here, and the cuvette just sits there across that bridge. You then close the lid and the machine is ready. But the cuvette has to be connected to a bag, or a bottle in this case, of sodium chloride. This is physiological saline, and we need about 60 ml of blood from the patient, and that's obtained by collecting it in a 60 ml cuvette here, which you can see. Again, I don't want to take out the packaging because it's sterile inside there, and those are connected from the patient, who has the usual butterfly 21 gauge needle. It's a bigger needle than normal because we want to get the blood out, and that then connects to the cuvette. The cuvette then is put in the blood from the cuvette is put into the NaCl bottle here, and in order to make sure there's enough room, it's usual to take out some of the saline in order to make room for the blood. The blood itself, of course, has to be heparinized. This cuvette is pre-heparinized. Usually a couple of thousand units is enough, and that's a standard procedure, really. I'd like to say that this machine has got an EC certificate. Here it is, so that there should be no difficulty in importing it into Europe, whereas some of the machines on the market in America are not in possession of an EC certificate and therefore cannot be imported. I did try and import one, and it was blocked by the customs, so just be aware of that. So I think that's about it. Now, the actual way you do it is you take the 60 cc of blood from the patient into the cuvette. You then mix it with the heparinized, mix it with the saline, hang it up in the bag, and then let the saline solution come back through the machine, which is turned on, and here's the window to make sure the lights are lit, and back into the patient. If there's any need for control, you can always clamp it to the extent needed to block the passage of the blood. And you can use your usual drip counter to check the flow rate of the blood back into the patient, and thereby the amount of exposure the patient's blood will receive in the machine. Well, that's a very simple explanation of the process, and that's about all there is to it. And this is not the only machine on the market. There are others. This one, the Ultralux 750, is one of the best, I would say, but there are others that are equally good. Theraflex have units, and so do, I think there's a French company as well, and I will be putting some examples of their machines next on this video.